The facility's patient accounts and billing system is actually done through several venues. Rebecca oversees the facility's finances, while other various employees in different departments oversee the patient billing and accounts receivable. It is a tiered process involving Sheila and HIM putting the codes and charges into the Charge Master program to be sent out to the various insurance companies. Chris and Tracy in the business department do the finalizing and sending and releasing of those charges, and then balancing things as the monies come in. They also follow up on proper codes or alternate codes that may be missed for charges that are unpaid. Lori and Sheila put in the codes for the hospital outpatient and inpatient encounters after Kayla puts in the charges. They are all then released by Tracy for the billing to insurance companies. If the charges are for self-pays, these charges are then sent to a billing service who then sends out the bills to the patients. Connie, in quality assurance, is also the risk manager for the facility, along with help of those in the HIM department and Rebecca Musman, CFO. All personnel in the facility work together to help with managing any risks that may be within the facility and notify Connie when an incident occurs that needs her attention. Connie ensures such things as the physician's credentials, continued education, and up-to-date physician signatures. She relies on the HIM department to help with the signatures as well as making sure that the medical records are properly completed. KCHS does not have a formal medical records committee. Each department is responsible for designing and implementing their own forms and documents. However, there has been discussion with regard to forming a medical records committee, according to Rebecca. Incomplete charts are done by Sheila on a bi-weekly basis. The state requires that all charts be completed within 30 days of the encounter, and just recently KCHS has updated their delinquent policy to meet these requirements. Previously, they had used a 15-day delinquency window. The facility has a 2-warning system for delinquent records. The first time, Sheila contacts the provider in an email reminding them that they have charts that need attention as soon as possible and gives them a date by which they need to be taken care of. This email also goes to the medical clinic manager and the nursing director for them to remind the provider of the incomplete record as well. When the provider is 30 days past the last encounter or discharge of a patient and the records have not been completed, Sheila notifies the CEO, CFO, Director of Nursing and Clinic Office Manager, as well as the physician or provider themselves. The completion of the charts that have been declared delinquent are now the responsibility of these persons to get the providers to complete. The majority of the providers are employees of the facility, and thus discontinuation of privileges is not an option. The provider is given another 30 days to bring his or her charts up to date. If, after 60 days, the provider has neglected to make his or her records current, they will then face suspension of services until at which time all of their records have been brought to date. This will affect the provider again when the provider is up for review of wage increase or review of contract, at which time the number of delinquent records is taken into account. As I am an employee of KCHS as well as a student, many of the experience I have encountered have been related to the work side of things. I really didn't have any major experiences while participating in my practical experience this semester. Some of the more interesting things that the facility is going through right now do have an effect on the HIM department as well as the facility as a whole. One of the major ones is the departing of a physician as well as one of the APRNs in the next couple of months. We are also working on updating the abbreviations list for the facility. This is the first time in about 10 years that this has been done, and with the new regulations involving JCO, we have to really revise things. I will also be attending the NHIMA conference in April as well as the Rural Health Clinic Training Seminar in April.